later in the show. I've said it many times before. Many of us in the media, we have insurance. You have to get out and talk to the people. And you have to get the real stories of America. And I'm proud that our crew, and I'm proud that this network allowed me to come here today after being down in Kansas City, and I'm proud to be associated with Keith Olbermann, who had the courage to stand out on the air and ask for donations from many of Americans out there who have donated to these free clinics to make it happen. And I report to you tonight that one life was saved today, and that should be important. And I don't know where the 1 yard line is on health care. I don't know where the 5 yard line is. All these analogies. I know where Washington is, and I know what the hell they're not doing. Joining me now is Nicole Lamoureux. She is the director, the national director of the Association of Free Clinics, and who is responsible for today's event. And Patricia Carroll is also a registered nurse who has been treating patients here today.
Hi, my friend.
Your eyes are wet.
Of course they are.
Your eyes were wet in Kansas City when I saw you. It's the same story, isn't it?
It's the same story. We've seen this since Houston. 1,000 people call in advance to come to one of these clinics. It doesn't matter if you're in Houston or Kansas City or now in the Gold Coast. They're still people. They're people. They're not a number. They're not a pill. They're not a statistic. They're people. And while Congress and the President and everyone else is discussing how we're going to make this program work, these people need an answer now. And we do need members of Congress to come and see what's going on. And we invite them over and over and over again. Come and see. See what these people are going through. And if you have to look at it this way, see what your constituents are going through and see what the votes are going through and come to one of these clinics.
Not too many politicians show up here, do they?
No, sir. They don't come. They don't talk to us on the Hill. They don't come to these events. It doesn't matter if it's a Democrat or a Republican. They don't come.
The Washington politicians.
The Washington politicians do not come.
Patricia Carroll, you're a registered nurse. I think you know the lady that I was talking about today.
She was my patient.
What happened?
She was patient number 2 for us today because she called to make her appointment as soon as she heard the announcement on Countdown. That's how badly she needed care. And she had some chronic health issues, but she'd noticed that she had swelling on the right side of her neck, and she was concerned about it. And we were able to hook her up today to get a biopsy and to get her referred. But the problem is, should she need surgery, who's going to pay for it? We don't have surgeons in hospitals here that provide care for free for cancer patients. So now she's got another hurdle that she's got to get over if she needs treatment for a cancer.
Now, a lot of the folks that came through here today and at the other clinics, it's just basic care could curb a big medical issue. Is that a fair statement?
That's a very fair statement.
So many times it's just a pill, it's a basic treatment that could really stop someone from having multiple medical issues down the road in a short period of time.
I actually stopped counting the number of people who brought empty pill bottles from a year ago to say, this is what I was on, but I can't afford it anymore. So we have pharmacists here today who have the lists of drugs that can be filled for $4 a prescription, or what pills can be cut in half. And the nurse practitioner I'm working with today has been able to work with them to change their medications so that they can afford their care.
You're both brave, and you're great at what you do, and I appreciate it so much, and thanks for sharing a part of your life with us.
Ed.
No, it is.
It's what needs to be done.
It's what we signed up for. When I got my license, this is what I signed up for.
But we all should be doing this. There but by the grace of God go I. And every single one of us should be doing this.
Joining me now is Connecticut Congressman Joe Courtney, his wife Audrey, who is a registered nurse practitioner. She volunteered here at this healthcare clinic today. Congressman, good to have you with us today. Give us an update, if you can, on where the pulse of the politicians is at this hour when it comes to passing and getting the health care done. And the president went over and talked to the Senate Democrats today and pretty much said, get this thing done. Where are we at this hour, Congressman?
Well, to be honest with you, I think we're at a pretty precarious moment. The issue's alive. I mean, there's definitely work being done on it, but I think this program, which really puts the spotlight on what the issue is about, it's not about this senator or this member of Congress. It's really about the people of this country and the people who are in Hartford, Connecticut today at the clinic. I mean, I want to salute you and all the staff that were there. Again, Audrey was one of the folks helping out today, and you know, what you've done is transform people's lives, change their lives, but the fact is we need a system in place so people can take care of themselves and not rely on charity and begging to get the care that a great country should be able to figure out a way to provide.
Congressman, do you believe the Senate should go reconciliation?
I do. You know, we've had visits on your show and other guests to talk about the problems in the Senate bill, which is going to, in my opinion, damage the support for this legislation for working families because of taxes and because of some of these crazy add-ons that took place in December. Once that's done, though, I think you're going to see movement in the House, and we can get this over with and get in place a system that a great country is worthy of in terms of supplying health care to all Americans.
Congressman, good to have you with us tonight. Thanks so much.
Great work, Ed.
I know you're you bet. Well, you're one of the good guys that keeps fighting for what has to be done in this country. And the thing that is so amazing, you know, if we cover every American, all these righties in Washington running around squawking about the budget and the deficit, we'd save money. We'd save money. We would save money if we would do this. Thank you, Congressman. Appreciate your time.
Okay, take care, Ed.
You bet. Thank you. Coming up, a congressman from the Heartland has had it with these massive bonuses that the folks at AIG are dishing out. Populist Representative Bruce Braley will roll out his blueprint for recovery in just a moment. Plus,